Thank you, brothers and sisters. Like she said, my name is Stanley Lyles, and I'm a respiratory care practitioner at Northridge Medical Center in Southern California, where I've been there for 35 years. And I was first introduced to the union, about 6 or 7 years ago, when I got a phone call from an organizer. And they said, some of your members or some of your coworkers are planning on forming a union. So I just hung up on her. I didn't want to hear it. But a few days later, a couple of members came knocking on my door. 2 Kaiser members from Local 399, now UHW, came knocking on my door and started talking to me about, if you join the union, you will have a say in what you do at your facility. You will be able to sit down with your employer and talk about health care, talk about pension, talk about job security. Funny she said job security, because about a year ago, they had what you call a re-engineering at our facility, and they laid off half of our respiratory department. And they didn't go by seniority. They went by who they like, who's been there the longest, you know, who was in their favor at that time. So it was totally unfair. So I started to listen, because we didn't want to repeat that again. Then she says, then they tell me about, you know, you can have a pension, free medical, free dental, free vision. I said, are you out of your mind? But they were honest. It was 2 ladies. But they told me that, but you had to go through a struggle. I said, well, what's the struggle? She says, well, it's not going to be easy, but it's going to be up to you, the members, to get it done. So after that first contract, we voted the union in, and we went through that struggle. And I can say here today at Catholic Healthcare West, all of our members have free health insurance for us and our families. We have free dental, free vision. We have a pension. We also have now a retiree health benefit. And believe you me, it was a struggle that we had to go through. Brothers and sisters, I'm here tonight because, along with the rest of my brothers and sisters, UHW is now going through a struggle with the International Union about these same fundamental principles. After years of building one of the most successful, the most progressive locals in America, we are now in the fight for our lives and for the future of labor movement today.
Right.
For nearly a decade, from 1996 until about the time to change the wind split from the AFL-CIO, we had worked hand in hand with Andy Stern's leadership, and often we were at the forefront developing and executing strategy we like to call growth through strength. Our strategy was to increase union membership and improve workers' lives, was based on building the capacity of strong local union, maximizing members' participation in organization, political, bargaining, and coordinating our strength across the entire industry through democratic structure and accountability to rank and file members. In the pursuit of this strategy, UHW was the most successful local in the country and the fast growing in SEIU. Between 2001 and 2006, we organized nearly 65,000 workers. We won some of the best labor contracts in the movement. We built one of the strongest political programs in the nation and changed the face of California health industry. Then, Andy Stern and other members of his leadership team began to be tiring of the struggle that it took to grow through strength, and started to try to induce employers to organize by limited, in other words, he tried to make a deal with the employers to organize us and limit our power in the meantime. I kind of have to tell you like it is. You know? I like to read from script, but sometimes I have to deviate, because sometimes you have to tell it like it is. Yeah. Yeah. They tried to convince, they felt that it wasn't easy to deal with the employer. They felt that we couldn't get contracts because if the employer were to deny you the contract, they say, well, we couldn't organize. Well, we know that's not true. We know everything comes with a struggle. You understand? So we have to struggle. And we didn't like the way he's trying to change our union by saying that he wants to make a deal with the boss. Exactly. He wants just a handful of the people from D.C. sit down and make a deal. What is it that you want? You know, how can we organize your workers? You know, what type of deal are you going to make for us? Well, we're not making no deals with them. You know, we hear so many things that you hear about Andy Stern and Sal Rosali, and I just need to say this. I don't know about a conflict between Sal Rosali and Andy Stern, but I can tell you what the conflict is. The conflict is that international SEIU is trying to take the voice away from the people. And our message is that it ain't gonna happen. You know, for too long that, you know, we're the workers, we're the people, we're the ones that are inside the hospitals, we're the ones that are inside the coal mines, we're the ones that are cleaning the floors, we're the ones that are putting the tires on the car, you know, doing the upholstery, doing the painting. We're the ones that are doing it, then we're the ones should be having a say in the direction of our unions.